With the surge of cases in COVID-19 in the country, doctors and nurses continue to push up against the breaking point as hospitals are being stretched. As a result, most people are resorting to self-medication, which in turn are causing more harm to them, as Caroline Suma now is reporting.
There is an increased pressure.
According to data released by Council of Governors, as of 1st August, 2,225 patients were under home-based care isolation across the country, and regions overtaken by COVID-19 Delta variant include Nairobi, Mombasa, Nakuru, Kiambu, Nyeri, and Kilifi County. Earlier this week, Health Cabinet Secretary Mutahi Kagwe warned Kenyans against self-medication against respiratory diseases.
Members of the public are strongly advised against self-medicating and the use of over-the-counter medicines for treatment of respiratory tract infections.
According to Peter Ayeko, a health representative at the Ministry of Health, says with the surge of Delta variant in the country, hospitals are already overstretched, and as a result, most people are resorting to self-diagnosis and treatment.
Most people are now getting OTC drugs, and they are trying to self-medicate. Just as we had been told before that now corona is about, sometimes you can do home-based care. So this home-based care basis has really put a lot of people away from the facts that you can be treating something that is not what you know.
Now, here is the thing. When you think of a ventilator machine, the first thing that comes in your head is a gadget that saves lives, especially those affected by COVID-19. But did you know that the same machine could actually take away your life? Here's how.
The reason why people get this is because those are people who have mostly been in the hospital, or they get advice from the friends who have been in the hospital, and they tell them we were using a ventilator machine, and this is how I see it was working. So they try to seek the advice from the specialist of this medical equipment. A medical ventilator machine has got parameters to be set. So if you buy a machine, for example, and you don't know how to set these parameters on the patients, you just press things, you're likely to cause scenarios where even a patient can die instantly by bursting the lungs.
On behalf of other medics, Ayeko urges the government to self-calibrate centers that will regulate the use of medical equipment.
There's a lot of freedom in handling medical equipment. The government to set up a calibration center for these medical equipment, because this medical equipment should not be in the hands of any person. They are not radios, and they are not any electrical gadget.
Caroline Suma, Switch TV.